I am Dr. Suhail Mahdi. Today's topic is why we need to choose dental implant over bridges or partials for missing teeth, and why dental implant is ideal replacement or the standard of care for missing teeth. One of the reasons, once you lose your tooth, part of the jawbone that where your tooth used to be is going to shrink or is going to atrophy, disappear basically. And that's why you see a lot of people when they have missing teeth, especially the people that wearing dentures, once they take their denture out, you're going to see they have dip right here in their cheek and they look older than their ages. And so one of the main reasons the implant or main advantage of implants, it's preserve that bone, prevent it from shrinking or disappearing, because it stimulates the natural bone to stay there and telling the bone, the body, that there is something there that's functioning and I need to stay there. So that's why the bone doesn't disappear. That's one of the advantage. The second advantage, or I would say the second disadvantage, or the disadvantage of having something else such as bridges, is that in order for you to have bridge, you have to prep the adjacent teeth so you could bridge that gap. And to prep a tooth, you have basically to shave it down and removing natural tooth structure, and basically destroy the anatomy of that natural tooth in order to replace a tooth. So in order for me to replace one tooth, I'm destroying two healthy teeth. So that's one of the disadvantage of bridges. So for me, these two things are big deal for picking implant as the first standard of care for missing teeth. Now let's talk about partial. So I mentioned partial for missing teeth. It's a great way. Previously people used it all the time, but imagine you're going to have to wear something, take it in and out every day. It's going to sit on the other teeth. It's going to collect food. You're going to have risk of cavities on the adjacent teeth, and it's very unnatural. People have problems speaking. Speech will influence, and your basically quality of life is different, because you're going to always have wear something. You have to take it in and out. Maybe while you're having dinner at a restaurant, you have to go to the bathroom, change, clean it, put it back in. So implants always doesn't have all that. It's the standard of care for missing teeth. One of the additional advantage of implant is that once you have a missing tooth and you have it like a tooth that put in, or dental implant put in the middle, you can always floss and clean in between the teeth, and that's great advantage because you're gonna prevent cavities on the adjacent teeth. You're gonna keep the mouth healthy, prevent periodontal disease or gum disease. Versus having a bridge, you have to connect three teeth. It's make it very hard to floss in between these teeth. The only way to clean around them, you have just to go with floss threader. You have to kind of thread around that bridge and try to floss, and it is very hard, especially in the back teeth. So you may use also water pick to clean under the bridges, but it's a hard process, make it difficult, put you under more risk of having cavities and the adjacent teeth, or risk of gum disease and a long term, of course. So you're preventing cavities, you're preventing gum disease with implant, you're preserving the bone, you have more natural chewing function, you have better quality of life. So multiple advantage of dental implant versus the other options for replacing missing teeth.